Hello and welcome to our presentation on Hunterdon's new Wellness Rewards program that we will be completing this year in 2016. And for those of you who don't recognize my voice, my name is Antoinette Rice, Tony, to most people here at the hospital, and I'm the one that's going to be talking to you today about the Wellness Rewards program that we have here at the hospital. So currently we're just talking about the Wellness Rewards program that Hunterdon offers to the employees that are currently enrolled in our medical plans. It's a process of completing wellness activities or just being aware and monitoring your wellness. You complete activities and forms and then you submit them to WellWorks. Our representative at WellWorks is Kristen Ippolito. So anything that you're doing to get credit for our Wellness Rewards program, all the information needs to be directed to WellWorks, okay? The benefits, or excuse me, the activities have to have happened between 2015 and 2016. So effective December 1st of 2015 until December 1st of 2016. You can get credit for anything that applies in that window. All right, so you don't have to worry about, oh, I didn't get it done yet in December, because last December still counts for this program year. Okay, and again, all submissions are being sent to WellWorks. They're not being turned into human resources. We do not want to be collecting medical information on employees in the HR department, okay? So we're sending the information to WellWorks where they'll make sure that everything is kept confidential for you. So what's new this year in our Wellness Rewards program is that you can earn cash, again this year, $200 in cash if you complete step 1 of the Wellness Rewards program. So you can still get cash this year because we're transitioning. So $200 cash in 2016, and then in 2017 you would earn a reduction in your biweekly payroll contributions for your medical insurance. So basically over the course of the year you would pay $600 less for your medical insurance in 2017. So if you look at that, it's about $23 a pay period. You take home, instead of giving to the insurance company or for premiums, which means you take home $600 that you wouldn't have. So that's the value. So if you add $200 in 2016 plus $600 less in premiums in 2017, the Wellness Rewards program is worth about $800. So the first step for employees to be thinking about is, getting that $200, right? How do you get the $200 cash? So the first thing you do is you go on to WellWorks for You and you register, right? You register to be able to use the portal for the Wellness Rewards program. Pretty straightforward, pretty simple. WellWorks for You, look it up online, register, and that's it. Takes about 2 minutes. Then you can go in and start looking at things. The other things you want to be thinking about doing is getting your annual physical, which of course we've done every year that we've had a Wellness Rewards program. And then once you've actually had your physical, doing the online, know your numbers or health risk assessment that's available online. Same thing that we've done for years, just a different place now. So those are the first 3 things that you want to do in order to get the $200 cash, okay? Then after that, at the same time, you want to be thinking about, okay, how can I earn these 100 activity points, right? In order to be eligible for the $600 reduction in benefit premiums for 2017, you have to complete these 100 activity points, okay? And again, you're keeping track of things and you're forwarding all the information to WellWorks as you complete them. So just be working through these steps, and I'll show you where you can kind of find a little bit of a grid or a way to track what you're doing online as well, okay? So here's the login page or the registration page for WellWorks. That's kind of step 1. You're going to go in and you're going to register at WellWorks for You. Step 1 activity helping you to earn that $200 is to register here. So once you register, you can go in and you can start looking around on the sites. I would strongly encourage you to go through the menu, the blue line at the top there, the drop-down boxes. Go and look at each of them individually. there is a toolbox there. The toolbox is where you can get all of the forms that you're going to need. If you want to go to the doctor and get your physical, there's a physical form on there. If you're doing other activities, and the guide is there as well. It lists all the different activities that you can do to be eligible for points. You can get a dental exam. You can get a vision exam. One of the first things you can do is turn in a smoking cessation form if you do not smoke. Easy 15 points right out of the gate. You get credit for being a non-smoker, 15 points. All you have to do is fax over the form. It's the easiest way, I think, if you're a non-smoker, to get your first 15 points. And you'll notice at the bottom there's also a thing that kind of is tracking what percentage you've completed of your 100 points. So in this example, I think it looks like they've got 40% or 30% completed. There's a bar at the bottom showing you how close you are to achieving your 100 points. So again, once you register, go in and take a look. There's learning series in there that you can take, these little online things, and what you're doing here as well. If you go in here and you listen to this, you get points for listening to this program. On this slide, we're showing you, again, another drop-down menu that you go to. So let's say you've registered, you've gotten your physical, right? You used the toolbox, you got your physical form out, you went for your physical. On the physical form that you completed with your doctor is a list of all of the things that you need to complete your numbers assessment, or the Know Your Numbers assessment. That's also located here. So now that you've gone for your physical and you've registered, you can take that information and complete the Know Your Numbers piece here. A few things are required. One of those things is waist circumference, but you can measure that yourself. That's a self-reported piece here. But just be aware of that. There's a couple of things that are mandatory to get through the process. One of them is the waist circumference, which the doctor's office doesn't generally do, but you can do yourself. So here is where you would go to complete the Know Your Numbers piece. So again, once you go through the book or the guide, which again is on the website that you're looking at, it's in the toolbox, there's a guide. If you haven't seen it already, many employees already have these guides, but if you haven't seen the guide, it's available online, it's available on the hospital's intranet. We've emailed it out several times. But the things that you can do are listed in the guide. Again, eye exam, colonoscopies, mammograms, annual OBGYN visits, lots of different things that you can do, activity logs, but you need these forms to be able to submit to show that you've completed them. So there is an activity or proof of visit form that you can submit, which is separate from the annual physical form, right? An annual physical form is for the annual wellness physical. But if you want to submit a form for your dental exam, you take a form, take it to the dentist's office, have it completed. If you've gone for an eye exam, same thing. Print up a new form, take it to the eye doctor, have them complete that you had your eye exam. You're going in for your OBGYN visit. That one you could probably indicate both, right? So if you're going in for your OBGYN visit, you can indicate that you've had your OBGYN visit and maybe your mammogram on the same form, because the doctor that's actually talking to you about your OBGYN care would indicate that you had those things done. Now, some women will say, well, what if my doctor that does my annual physical and my OBGYN visit at the same time? Well, then you would need to take two forms, right? One for the doctor to complete because they're doing your annual physical, and then one form that indicates that you've had your annual OBGYN and mammogram visit. Same thing if a gentleman's going and they're having their annual physical and a prostate exam. You'd have to take two forms to that visit. So just so you understand, two sets of forms. One for different types of visits, one form for the annual physical. Okay? And you get about 15 points per routine screening, so you want to get credit for anything that you're doing at that preventive wellness visit. Also, if you have a spouse on the plan, that they are a covered participant on the plan, meaning that you have employee plus spouse or employee plus family coverage and your spouse is on the plan, they can go and get their annual preventive wellness visit, and that visit counts towards points, towards your 100. That's the only thing that the spouse can submit for, but they can submit for their annual preventive wellness visit. So we strongly encourage that. So if your spouse is on the plan, you can earn 15 points towards your 100 if your spouse goes in for their annual physical. And remember, if your spouse had an annual physical in December of 2015, it counts. If you had an annual physical in December of 2015, it counts. If you had your dental exam, your vision exam, any of those exams were done in December of 15, you can get credit for them. You'd still have to take the form in and have the provider complete it. But think backwards. What did you have done between December of 15 and now, so that you can get credit for those things? They still count, even though we started the program in about May. We wanted people to be able to get credit for their wellness activities that began in December of 15. Another way employees can earn points is participating in challenges. So we've had many employees that have participated in our walking challenge. We have a walking challenge going on right now, a virtual walk to Disney. We had a healthy wage challenge that was announced, and employees have participated. We'll probably be doing another one of those in January. So if you're participating in any of the challenges that the hospital is sponsoring as part of this program, you can get credit or points towards your activities for that as well. You can also get credit for activities that you might be doing outside of the hospital. So if you are participating in, 5Ks, swimming, something that's being, that you can show proof of participation for, whether you've registered for the event and you've paid for the event, those sorts of things. Any of those kinds of activities you can also get credit for as well. If it's under a 5K, it's 5 points per race or activity. Here again, if you are participating in a race or a challenge outside of something that the hospital is doing for employees, you still get credit for it. It could be walking, running, and again, based on distance, if this is 5K or greater, this one you can get 10 points per race or 10 points per walking. The variation depends upon distance. We also have been doing lunch and learns, and if you attend one of the lunch and learns, you can get 5 points per lunch and learn if you attend. And even if you're not able to attend, we are posting the presentations like this one online at WellWorks, so you can go on, listen to it, and then take that little questionnaire at the end, and that way you can get credit too, and you can do it, from a desktop. You don't have, there's a lot of people that can't get to these lunch and learns in the auditorium. But however, just be aware that we are willing to come to you. If you've got a group of people that want to do a lunch and learn, and we come to your if you're at an off-site location, the hospital, the HR department, we're happy to come to you. But this is something that employees asked for, so we're putting them online so you can get credit for these when it's convenient for you to take them. Another way to earn points is, just regular physical activity. A lot of employees like to keep activity logs to track their own activities. And you have to complete 70 activities between December 1st of one year and December 1st of the next year. So instead of handing in a monthly log, you're basically just handing in, a series of logs at one time, or at some point that you complete 70 activities. So we have a lot of employees that are regular members of gyms, and you can just print off your monthly activity sheet. I know a lot of gyms will allow you to print a record of how often you've come in, how many times you've come in a particular month. I would just say take those, hang on to them, print them up. If you've done 70 activities in 6 months, print them up and send them in to WellWorks. Just make a fax in a copy of the recorded visits that you have, or again, go online. There's in your toolbox you can complete your own activity logs. Let's say you're exercising at home, or you're walking, or you do something. You're one of those disciplined individuals that just does it on their own. Just track it in your activity log, and then once you've gotten to 70 activities, submit it again to WellWorks. Another opportunity to earn points is right online at your wellness portal entrance. On the menu is Learning Series, and you can go in there and you can take a series where you learn about diabetes care, or you learn about stress management, or smoking cessation is available as a learning series that's right on your wellness portal. And it is basically 6 weeks of going in and watching a short video and taking a short quiz afterwards and kind of thinking about it and then moving on to the next one. So you have to allow yourself 6 weeks to complete one of these learning series. So you have to be starting this, in October, beginning of October, in order to be able to complete it by the December 1st deadline. Okay, but there are 3 learning series activities: diabetes, smoking cessation, and stress management. So you can go out and you can do these and learn a little bit, but you cannot take them back to back. You can't go and finish 6 modules in one day. You have to take a module, take the test, and then incorporate it and think about it for a week, and then move on to the next module. So ensure that you allow yourself at least 6 weeks to complete these learning series. You can take more than one learning series at the same time in the same 6-week window, but you can't take the modules back to back. Another opportunity is weight management programs. You can participate. Again, you could have done the weight loss challenge. That would have been a challenge, but if you're participating in Weight Watchers at Work, the hospital has a Weight Watchers program here that employees like to participate in. But even if you're not doing it at the hospital, let's say you're participating in an OptiFast program. Let's say you're participating in Weight Watchers online. As long as you have some kind of documentation to show that you're participating in one of these programs for 12 consecutive weeks, you're eligible for points. Okay, a lot of people like to do this, and they maintain this throughout the year, and you're eligible to get credit for it. So an example of how you get credit is like when you go to Weight Watchers, you have those little books and they sign and date them for you. You can make a photocopy of that little log from your Weight Watchers meetings, and that's a way to prove that you've attended 12 weeks of continuous Weight Watchers meetings or something to that effect. So, different programs have different things, but as long as you can provide documentation that you've been participating for 12 consecutive weeks, you can get your points for that. Again, this is a pretty easy 15 points for those of us that are non-smokers. If you are a non-smoker, you just are going to go on to the website, get the form off of your toolbox, right? So you go on, you register, you go into the website, and on that first drop-down box, our resources, I believe it's called, and you go in there and there's a toolbox. And one of the forms in your toolbox is a smoking attestation form. So if you complete that smoking attestation form saying that you are a non-smoker, that is worth 15 points. You fill out the form, fax it over to Kristen over at WellWorks, and you're on your way. 15 out of your 100 points have already been achieved. If you are currently a smoker, you can also get the 15 points. And you can participate in one of the smoking cessation programs. So if you participate in a 6-week smoking cessation program, they're available in the Occupational Health Department. It doesn't have to cost you anything. If you wanted to contact Linda Powell, she's our healthcare coordinator. She's certified in smoking cessation as well. She can assist you with achieving this, give you guidance. You have to show either proof of 3 office visits or 5 phone calls, and then if you choose, you can participate in the 6-week learning series, but you have to begin the program no later than October 19th. So very important that people start these programs to make sure that you can get it done by December 1st. But for those of you that are smokers, there is still the option to achieve that same 15 points. It just might take a little bit more effort for you, but you can still get to the same 15 points. You can also get 5 points for participating or registering, rather, for the hospital's patient portal registration. So we have the ability for employees or patients to register with NextGen, with Hunterdon Medical Center, to access physician information, medical records, make requests for prescriptions, things like that. So the hospital does have this patient portal, and if you go online and you register for the patient portal, it's worth 5 points. If you already have registered for the patient portal, you can just go take a screenshot of your registration. I registered for this, probably more than a year ago, but as long as I can show proof that I have registered for the patient portal, I can get my 5 points, okay? And again, just reiterating that all the documents that you need for anything related to this program are available on the WellWorks for You website. You can go out there and anything can be downloaded, can be printed directly from the site. again, you're going to go into the Wellness portal under, My Profile, and that's where your Wellness Toolbox is, and that's where the guide for the whole program is. That's where the forms for the program live, and that's also where you can kind of keep track of what you've achieved. There's a link in there as well. And again, I strongly suggest that you go through the menu and look at everything that's in there. It's very user-friendly, so please don't be intimidated. And again, just another picture here to show you if you've gone on, you've registered. Here is your profile menu, and then it's just showing you where that Wellness Toolbox is located. It's the second from the top in the menu there. And here again is the contact information for our representative at WellWorks. Again, her name is Kristen Ippolito. You can scan things and email them to her. You can fax the information to her. You can mail the information to her. You can also call her by phone if you're having any issues or you don't agree with something or you're questioning something about how the program works or what you get credit for. You can also reach her by phone at 610-235-2585. And please, by all means, feel free to reach out to me or to Allison as well, but we will often just refer back to Kristen, for clarification on things. So you have a direct line to her. And I would also recommend that if it's getting close to the December 1st window, I would not recommend mailing anything. I would make sure that you're either emailing or faxing the information so you can keep a copy of it and you've got a date stamp on when you're sending it. Again, there's lots of things to look at when you go on to the WellWorks website. You can find apps on the Play stores if you want to put the access to the portal like on your phone, on your pad. There's a ton of stuff out there: recipes, grocery lists, pedometer information. You can sync your pedometer with WellWorks. Right now we're doing a challenge. It started on October 1st. So people that have Fitbits, things like that, you can actually link your devices to WellWorks for you. It makes it real easy to track steps and things like that. You can still do it manually. So if you're not into the technology, don't worry about it. You can still participate. You can still track your track your steps on just a little pedometer that you're wearing on your waist that you can write down your steps each day. But you can link your information to WellWorks for you. Make it a little easier if you like it. And then again, you can put that stuff on your phone. So lots of technology here for those of us that are techies and love all this stuff. And again, just reminding you that you want to go out to get your first $100 of the two. You're going to go out, you're going to submit your physician results form to WellWorks for you. You know your numbers and register, so you want to do that stuff. Then once you achieve your 100 activity points, you get another $100. So you get the first 100 for your physical, for your know your numbers and registering. You get another 100 for actually achieving the 100 points. You get those $100 in 2016. So $100 for doing the registration, the physical, and the know your numbers. And then when you achieve your 100 points, you get another $100. And by achieving those 100 points in 2017, you will see your biweekly payroll contributions for medical benefits reduced by $23 a pay period, which is a $600 value over the course of the year. Okay? Okay, and again, this is just a reminder that the information needs to be submitted to Kristen at WellWorks. You should not be sending anything to HR. You don't want to be turning anything into HR. Any of this information needs to be sent directly to Kristen at WellWorks. Her information is on the website, and it was in that slide previously here today as well. And just again, reminder, reiterating that you have from December 1st of 2015 until December 1st of 2016. Okay, so anything that you've done that applies to the program that falls between December of last year, the 1st of December last year, and the 1st of December this year, you can apply for points. Okay, you just have to submit a proof of visit form for the service. You have to just be able to provide documentation that that service occurred, what was it, how does it apply, and send that off to Kristen. Okay? This, again, our reminder, deadline for 2016 is December 1st. Okay? So you want to make sure that all of this stuff is in by December 1st. It's not the 1st of the year. It's not December 31st. It's December 1st, okay? And again, if you haven't had your physical done in December of 2016, because it hasn't happened yet, it doesn't matter. If you had your physical done in December of 2015, it still applies. So as long as you had an annual physical between December 1st of 15 and December 1st of 16, whenever that happened, it applies. You don't have to have your 2016 physical in December of 2016. If you had it in 15, you can use it, all right? So just everybody, we want to make sure everybody's clear. December 1st is the deadline for the program. They're not going to accept anything after December 1st. So this is the conclusion of our presentation on the WellWorks program. So please feel free to email any feedback that you have on the presentation. This is the first time we're doing these this way, and hoping that this meets the expectations that employees had. They wanted to be able to take this themselves outside of having to travel to the auditorium. Makes it a little more time-friendly for people. So please let me know if there's anything that you would like to see us do differently. You know I love feedback. You can email me at rice@hhsnj.org, or just go back to the first slide where all my contact information is. Okay? Thank you. Bye-bye.